Okay, let's dive into a part of our pet's health that, well, it's easy to overlook sometimes, but where some pretty serious issues can hide their mouths.
Hmm.
I mean, we're usually pretty good at noticing if they're limping or, have a lump somewhere on their skin.
Right.
But how often do we really get a good look inside at their gums and teeth?
Exactly. And it turns out focusing on their oral health is incredibly important because one of the most common oral cancers in both dogs and cats actually starts right there in the gum tissue.
Okay, and that's what we're tackling today.
That's right. We're talking about gingival squamous cell carcinoma, SCC for short. It's a malignant tumor that starts in those cells lining the gums, the gingiva. It's a really significant diagnosis.
So for this deep dive, we've gathered your source material to really get into what gingival SCC is, what signs you need to watch out for, how vets figure it out, the treatments.
And crucially, what the likely outcome, the prognosis, looks like for our pets.
Yeah, our mission here is to sort of cut through the clinical jargon in these sources and give you the essential info you need about this condition.
Let's do it.
So, okay, let's get straight into it. When the sources talk about gingival squamous cell carcinoma, what are we talking about, like fundamentally?
Fundamentally, it's a cancer starting in those specific cells, the squamous epithelial cells in the gum tissue. But the critical thing about gingival SCC, and really what makes it so challenging, is its behavior.
Okay.
It's known for, well, progressing pretty quickly and being highly locally invasive.
Locally invasive. Break that down a bit. What does that actually mean for the pet?
It means it doesn't just sit there like a neat little bump on the surface. No, it aggressively infiltrates, it destroys the tissue immediately around it.
Ah,
And in the mouth, that's especially bad because it often means invading and, well, eating away at the underlying bone, the jawbone, the mandible, or maxilla.
wow.
The sources really highlight this aggression. One actually notes that a striking 77% of these tumors show bone invasion.
77%. So it's literally destroying the jawbone.
Yeah.
Yeah, that's a tough image. Does this cancer also, like, spread elsewhere in the body? Or is that local destruction the main worry?
Well, that local invasion, especially getting into the bone, is often the primary challenge. And honestly, it's why treatment can be so difficult. But metastasis spreading it can happen. It does happen.
Right. How likely is that, the spreading part?
Initially, the most common place for it to spread is nearby to the regional lymph nodes, under the jaw.
Okay.
Sources put that initial risk at roughly 10–20% in dogs and cats when it's first diagnosed. Another source gives a slightly wider range, maybe 10–30% for dogs, 20–30% for cats.
Then further away, like the lungs.
Yeah, distant spread, usually to the lungs. That's less common right at the beginning, but it can definitely happen later on. One source mentions lung mets eventually showing up in up to 36% of dogs. It's considered much rarer in cats, though.
Got it. So the picture is really destructive right where it starts, locally, but there's still a definite risk, especially maybe in dogs, that it could travel further down the line.
Exactly. Controlling it locally is absolutely key, but you can't just ignore the possibility of spread.
All right, so who tends to get gingival SCC? Is there a certain type of pet, we should be more vigilant about?
Well, unfortunately, it's one of the most common oral tumors we see overall.
Really?
Yeah. In cats, it's actually the #1 most common oral malignancy. It accounts for something like 60–70% of all mouth tumors found in cats. It's huge.
Wow, 60–70% in cats. That's way higher than I would guessed. What about dogs?
In dogs, it's up there too. It's the second most common. Makes up about 20–25% of their oral tumors, often right after melanoma.
Okay, still very significant. And age, does it tend to hit older pets?
Generally, yeah. The mean age when they're diagnosed is around 10.5 years, looking at both species.
Yeah.
But the sources are clear. It can affect pets across a really wide age range, think 3 years old, all the way up to 15. One source specifically mentioned an average age of about 8 to 10 years for dogs. So yeah, more common in older pets, but you definitely can't rule it out just because a pet seems younger.
Okay. Are there any breeds or maybe sizes of dogs that seem more prone to it based on the sources?
Yes, for dogs, it does seem to pop up more often in medium and large breed dogs, and some specific breeds might be overrepresented. One source listed Shetland sheepdogs, Siberian huskies, basset hounds, and golden retrievers.
Interesting. Okay. And for cats, I noticed some potentially surprising risk factors listed in the sources. What did they mention there?
Ah, yes, this is where it gets really interesting and maybe a bit controversial.
Oh.
For cats, the sources bring up potential links, and I stress potential, to things like flea collars, eating canned food, specifically eating tuna, and also exposure to tobacco smoke.
Wait, flea collars in tuna. That feels unexpected compared to tobacco smoke, which kind of makes intuitive sense.
Right.
Did the sources explain why those things might be linked? Like, what's the connection?
They're listed more as potential factors, things observed in studies or data, rather than like definitively proven causes with a clear mechanism. Cancer research is tricky, you know?
Sure.
They don't really dive deep into the how or why in the sources we looked at, but it does make you think about how environment and diet might play roles we don't fully grasp yet.
Yeah, definitely.
Things like chronic inflammation, like really bad gum disease, that's also sometimes speculated as maybe contributing in some cases. But the exact cause, mostly it's still unknown.
Fascinating stuff. And a good reminder, it's not always the obvious things. So we're supposed to be checking our pets' mouths. What specific signs should we be looking for? What might hint at gingival SCC, especially since you said it can be subtle at first?
Yeah, you're right. The early signs can really just look like everyday dental problems.
This is like maybe just really persistent bad breath, that kind of thing.
Exactly. Owners often report things like noticing a lump or mass finally becoming visible, or maybe excessive drooling, what we call tyolism, difficulty chewing or swallowing, dysphagia, that really foul, almost necrotic bad breath halitosis.
Ugh.
Yeah, sometimes bloody discharge from the mouth, weight loss, maybe they're just not as interested in eating. And cats, sometimes they stop grooming themselves properly because their mouth hurts.
Right, that makes sense.
Yeah.
And what might a vet pick up on during an exam? Maybe something the owner missed.
Well, a vet, especially if they can get a really good look, maybe under sedation, they might see an abnormal lesion on the gums, and it can look really different depending on the case. It could be red and inflamed, ulcerated, kind of fleshy, or even proliferative, like a little cauliflower. Or sometimes it's more sneaky, just looks like swollen tissue if it's growing inwards and filtrative. One source mentioned at the front of the lower jaw, the rostral mandible, is a really common spot. Other things they might find are loose teeth right in that area, maybe facial swelling, or even a change in face shape if the bone's involved.
Wow.
Potentially even a bulging eye, exophthalmos, if it's an upper jaw tumor growing back towards the eye socket. Pain when trying to open the mouth is a big one. Or maybe feeling enlarged lymph nodes under the jaw.
So basically, any weird, persistent swelling, is sore in the mouth, or really bad breath that just won't quit, trouble eating, facial changes.
Yeah.
Those should all be red flags, right? Get it checked out.
Absolutely. Don't just write it off as, oh, they're getting old, or simple dental stuff without a proper vet check.
Okay.
And that brings us right to the detective work needed to actually diagnose it. Because you mentioned it's tricky to nail down initially. Why is that?
Well, like you said, the signs overlap so much with other common problems, right? Like a tooth root abscess or just really bad gum disease.
Precisely. The early symptoms just aren't specific only to cancer. And just getting a good look inside a potentially painful mouth often needs sedation or even full anesthesia for a really thorough oral exam.
Right. So once the vet gets a good look and sees something suspicious, what else could it be? What are they trying to rule out?
Oh, the list of possibilities, the differential diagnoses, it's actually pretty long.
Okay.
The sources mention, of course, other types of oral cancer: melanoma, fibrosarcoma, osteosarcoma, which is bone cancer itself. Also, locally aggressive but technically non-spreading tumors like acanthomatus, ameloblastoma. But they also need to rule out non-cancerous things that can look nasty, like serious tooth root abscesses, benign growths like gingival hyperplasia or epulus, inflammatory issues like eosinophilic granuloma complex in cats, other infections, even just a foreign object stuck in there somewhere.
Okay, so finding a suspicious spot is really just step one. What are the key diagnostic steps they take then to get that definite answer and figure out how bad it is?
Imaging. Imaging is absolutely crucial. It's essential for figuring out that local bone invasion we talked about, and also for checking if it's spread.
What kinds of imaging are most helpful here? X-rays?
Well, regular skull x-rays or radiographs can show bone involvement, but honestly, they aren't super sensitive. You often need like 40–50% of the bone to be destroyed before it even shows up clearly.
Oh, wow.
Dental x-rays, the little ones like we get at the dentist, they're actually more sensitive for seeing localized bone loss, especially in the lower jaw, the mandible.
Okay.
But the sources are pretty unanimous. Computed tomography, a CT scan, is considered the gold standard for local staging.
Gold standard. Why is CT so much better?
Okay, think of a regular x-ray, like it's just a flat picture, right? A shadowgram. A CT scan is like taking hundreds of x-ray slices from all different angles and using a computer to stitch them together into a detailed 3D model of the head.
Ah, okay.
So it's fantastic for precisely mapping out the full extent of the soft tissue tumor, seeing exactly how much bone has been invaded that osteolysis checking if it's getting into nearby areas like the nasal cavity or the eye socket, and also for getting a really accurate look at those regional lymph nodes. Before you even think about surgery, it gives the surgeon a much, much clearer roadmap.
That makes total sense for planning surgery. What about checking for spread further away, like to the lungs?
For that, you need thoracic radiographs, chest x-rays, ideally taking 3 different views to get a good look all around. That's essential to screen for a lung metastasis.
Okay.
Abdominal ultrasound is less commonly needed specifically for SCC, but it might be part of a really thorough metastatic workup, depending on the whole picture.
So imaging tells you where it is and if it's spread.
Mm.
But how do they confirm exactly what kind of cells are causing the problem?
Right, for that you need tissue samples. Trying to just suck out cells with a needle cytology, a fine needle aspirate, is often, frankly, non-diagnostic for oral SCC.
Why is that?
Because the surface of these tumors is frequently ulcerated and really inflamed, so what you often get back is just inflammatory cells, maybe some bacteria, not the actual cancer cells you need for a diagnosis.
So not reliable for the final word then.
Usually not for a definitive diagnosis, no. You really need a biopsy. This means taking an actual chunk of tissue. It needs to be a deep sample, ideally going right down to the bone, and then you send that off to a pathologist for histopathology. They look at the tissue structure under a microscope.
Gotcha. Can they take the whole thing out as the biopsy?
Sometimes, if the tumor is really small, they might do an excisional biopsy, taking the whole thing out right away for diagnosis. More often, especially if it's larger, it's an incisional biopsy, just taking a representative piece first.
And what about checking those lymph nodes you mentioned? Is that part of the biopsy process too?
Yes, absolutely. Getting samples from those regional lymph nodes, mainly the mandibular ones under the jaw, and sometimes the retropharyngeal ones further back, is critical for accurate staging, even if they don't feel enlarged when the vet examines them.
Why is it?
Because microscopic spread can be hiding in there. Sources mention those microscopic lymph node metastasis rates being, 10-20% initially in dogs and cats, or maybe 10-30% in dogs and 20-30% in cats, according to another source. So often, taking out those lymph nodes entirely, a lymphadenectomy is done at the same time as removing the main tumor, just to get the most accurate picture of any potential spread.
And the pathologist, looking at the biopsy, they can also tell you how aggressive the tumor seems.
Exactly. They do what's called histologic grading. They look at specific features of the cells, like how abnormal they look compared to normal cells, that's differentiation, and how fast they seem to be dividing, mitotic index. A tumor that's poorly differentiated, meaning the cells look really weird, and has a high mitotic index, lots of division, that's generally considered more aggressive.
Okay, that makes sense. So we've covered what it is, who gets it, the signs, the whole diagnostic journey. Now let's talk treatment. What's the main weapon against gingival SCC, according to the sources?
The primary treatment, the one that offers the best shot at long-term local control and survival, is aggressive surgical resection.
Aggressive surgical resection. Yeah, that sounds pretty intense. What does that usually mean in practice?
It means removing the tumor completely, with wide, clean margins of healthy tissue all around it.
Okay.
And because this cancer is so locally invasive, especially into bone, this very often requires removing a piece of the jawbone itself. These are procedures called mandibulectomy for the lower jaw or maxillectomy for the upper jaw.
Right.
The goal is typically to get 1 to 2 centimeters of healthy tissue surrounding the visible tumor. One source even noted that for small lesions in cats, you might need 2 to 3 centimeter margins. It's serious removal.
Removing part of a pet's jaw. I mean, for a lot of owners, that must sound incredibly scary, like it would just devastate their quality of life.
Yeah.
What do the sources say about how pets actually do after such extensive surgery?
That is such a common and understandable concern, and the sources specifically make a point to highlight that pets often adapt remarkably well to these big oral surgeries.
Really?
Yeah. While it's definitely a major procedure, many dogs and cats maintain an excellent quality of life. They figure out how to eat, they function well afterwards. It sounds so drastic to us as humans, but for them, it's often the very best way to deal with that deep local invasion and give them a good chance.
That is genuinely reassuring to hear. But even with that kind of aggressive surgery, is it, guaranteed to be gone for good?
Unfortunately, no guarantee. The risk of it coming back locally, local recurrence, is still pretty significant. The sources mention rates around 20 to 50%.
Wow, still quite high.
Especially if those surgical margins weren't perfectly clean under the microscope, meaning some microscopic cancer cells might have been left behind. Because the tumor is so aggressive and because of that potential for spread we talked about, A multimodal approach using more than one type of treatment is actually very common.
Okay, multimodal. So what other treatments might be used alongside surgery, or maybe instead of it in some cases?
Radiation therapy, RT, is a really important one. It's very effective for local control of SCC.
How is it used?
It can be used in a few ways. Adjuvant radiation, meaning after surgery, especially if the margins were narrow or incomplete, to sort of clean up any remaining cells. Neoadjuvant, meaning before surgery, sometimes used to try and shrink a very large tumor to make surgery more feasible.
Okay.
Or palliative radiation for tumors that just can't be removed surgically, aimed at slowing growth and controlling pain, improving comfort. And sometimes, though less commonly, radiation might be the primary therapy if surgery just isn't an option at all.
Are there different types of radiation protocols?
Yeah, broadly speaking, there are curative intent protocols, which involve higher total doses given over many treatment sessions, aiming for long-term control or cure. And then palliative protocols, which use lower doses over fewer sessions, really focused on improving quality of life and managing symptoms.
Hmm.
It's worth noting, one source mentioned that palliative radiation in cats seems to have a response rate of less than 50%, so maybe not as reliably effective for palliation in cats.
Okay. What about chemotherapies? Chemo a big player for gingival SCC?
Right. Generally speaking, chemo is not considered highly effective as the only treatment for oral SCC. It doesn't usually shrink these tumors dramatically on its own.
Right.
However, it can be used as an adjuvant treatment again, alongside other therapies, particularly if metastasis to the lymph nodes has already been confirmed, or if the pathologist grades the tumor as being particularly high-grade or aggressive.
Are there specific chemo drugs mentioned in the sources?
Yes, a few are mentioned. For dogs, a drug called tosarenib phosphate, brand name Palladia, is noted. It showed some activity in a good percentage, like 75% of treated dogs in one study mentioned.
Okay.
Cisplatin is another one listed for dogs, but it comes with a huge warning. You absolutely never use cisplatin in cats. It's fatally toxic to them.
Wow. Okay, good to know.
Yeah, critical point. Even in dogs, cisplatin requires special fluid therapy during administration to protect their kidneys. Another drug, carboplatin, is related to cisplatin but is safer and can be used in both dogs and cats. Methoxytrone is another chemo drug mentioned sometimes for cats, and interestingly, piroxicam, which is actually an NSAID, like a non-steroidal anti-inflammatory drug.
Like aspirin or ibuprofen, but for pets.
Sort of, yeah. It has some anti-cancer effects too, and has shown an ability to cause partial remission in some dogs with oral SCC. Its use in cats isn't as well established from the sources, but it's sometimes used anecdotally.
Interesting. An NSAID having anti-cancer effects. Okay, so radiation is a key partner to surgery. Chemo is more of an add-on for specific situations, and that huge warning about cisplatin in cats. Are there any other localized treatments mentioned?
For very small superficial tumors that haven't invaded bone, things like cryosurgery freezing the tissue or maybe photodynamic therapy might be considered as options. One source mentioned a small study where photodynamic therapy used with surgery for small tumors resulted in a median survival time of 17 months in just 8 dogs. So niche applications, perhaps.
Gotcha. And what if the disease is really advanced or the owner decides against aggressive treatment? Is palliative care the main focus then?
Absolutely. Palliative care is incredibly important for managing comfort and quality of life in advanced cases, or when curative intent treatment isn't pursued.
What does that involve?
It's really focused on robust pain management, often using a combination of different types of pain meds, NSAIDs, opioids, drugs like gabapentin or amantadine that work on nerve pain. Nutritional support is also vital because a painful mouth obviously makes eating hard. This might involve appetite stimulants or sometimes even placing a feeding tube to ensure they get enough calories.
Okay, so after navigating diagnosis and treatment, what's the bottom line? What does the outlook, the prognosis generally look like for a pet with gingival SCC? What things make the biggest difference?
Yeah, the prognosis, it really varies quite significantly. It depends heavily on several critical factors that the sources outline.
And what's the single most important factor they point to?
The sources are very clear on this. The completeness of that initial surgical excision, getting those wide, clean margins we talked about that dramatically improves the prognosis. If the margins are incomplete, dirty, then that high risk of local recurrence really brings the expected survival time down.
Okay, clean margins are key. Does where the tumor is located in the mouth matter too?
Yes, location is definitely important. Tumors that are right at the front of the mouth rostral lesions generally carry a better prognosis than tumors further back caudal lesions, especially if they involve the tonsil area or the pharynx.
Why is that?
It mostly comes down to surgical accessibility. It's just much easier to achieve those wide, clean surgical margins at the very front of the jaw compared to way in the back.
Makes sense. And we touched on this earlier, but that difference in prognosis between dogs and cats is pretty stark.
Unfortunately, yes. The sources consistently indicate that the prognosis is generally significantly better in dogs than it is in cats.
Right. Can you give us some maybe median survival time numbers from the sources to illustrate that?
Sure, so for dogs, if you have aggressive surgery on a tumor at the front of the mouth and you achieve clean margins, the median survival times MSTs can range from 12 to 24 months, sometimes even longer. Some dogs can achieve long-term cures.
That's pretty good for cancer.
It can be, yes. One source citing studies using combined surgery and radiation therapy noted a median survival time of around 34 months. Some of those chemo protocols we mentioned, when used with or without surgery, also showed some promising MSTs in small studies.
But what about the less ideal situations for dogs?
Right. If the tumor is further back in the mouth or if those surgical margins are incomplete, the median survival time for dogs drops quite a bit, often more in the range of 6 to 12 months.
Okay. And now for cats, where you said the prognosis is generally tougher.
Yeah, for cats. The prognosis is unfortunately usually described as guarded to poor. Feline oral SCC just tends to be more aggressive, more invasive, right from the get-go, it seems.
So what are the typical survival times?
The median survival times are much shorter, sadly, ranging from a really challenging 2 to 10 months, even with aggressive surgery.
Wow, even with surgery.
Yes. Palliative radiation might offer median survival times somewhere between 2 and maybe 6 months, potentially up to 10 months in the rare cases that achieve a complete remission, but that's less common. There was one small study mentioned suggesting female cats might do a bit better with certain advanced radiation protocols, stereotactic RT, than male cats, but overall, it's tough.
So definitely a much harder battle for cats, even when you throw everything at it. What other factors generally make the prognosis worse for either species?
Well, confirming that the cancer has already spread, either to the lymph nodes or especially to the lungs, that significantly worsens the prognosis, as you'd expect.
Right.
Also, larger tumor size at the time of diagnosis, and tumors that the pathologist grades as poorly differentiated or high grade, those are also negative prognostic factors. And one source did mention older age as potentially being a negative factor for dogs as well.
Okay. So after treatment, assuming things go relatively well initially, what does the long-term management and follow-up look like?
Regular rechecks are really crucial. Initially, the vet might want to see them back every 1 to 3 months. If things seem stable after a while, maybe stretching that out to every 3 months.
And what happens at those rechecks?
They involve really thorough oral exams, looking carefully for any signs of the tumor coming back, palpating those regional lymph nodes carefully, and doing periodic chest x-rays, those thoracic radiographs, to keep screening for any potential spread to the lungs.
And even with successful treatment, are there potential long-term side effects or complications from, say, having part of the jaw removed?
Yes, there can be. Potential complications include, obviously, the tumor recurring, but also things like long-term excessive drooling, pyelism. Something called mandibular drift can happen, where the remaining part of the lower jaw shifts over time, causing the teeth not to line up properly. That's malocclusion, which can make it hard to grab food, what we call prehending. And sometimes, particularly noted in cats, they might lose the ability to groom themselves effectively.
Okay, so given everything we've talked about, the aggressive nature, the complex treatments, the very different prognosis, sometimes what are the absolute key takeaways for a pet owner if they get this diagnosis for their dog or cat? What do the sources emphasize they need to understand?
Yeah, the sources hit on several really key points for client education. First, it's crucial to understand this is a malignant cancer, and its defining feature is that aggressive local invasion. That's why extensive surgery is so often recommended, even though it sounds daunting. Second, it's really important to stress how surprisingly well most pets do adapt to these jaw surgeries and can maintain a really good quality of life afterwards.
That reassurance seems vital.
Absolutely. Third, especially for cats, it's vital to be realistic about the generally poorer prognosis compared to dogs and the potential need for supportive care like feeding tubes. Fourth, understanding the importance of staging, checking those lymph nodes, checking the lungs to really know the full extent of the disease before making treatment decisions.
Okay.
Fifth, recognizing that often the best approach is multimodal therapy, combining surgery, radiation, maybe chemo, rather than relying on just one thing. Sixth, Setting realistic expectations is key. Recurrence or metastasis is possible, even with the best treatment. Seventh, emphasizing that pain management and ensuring good nutrition are absolutely paramount for maintaining quality of life throughout. And lastly, acknowledging that these advanced diagnostics and treatments can, unfortunately, be costly.
It really sounds like you almost always need a team approach for this.
Definitely. A collaborative effort involving your primary care vet, perhaps a veterinary dental specialist, and critically, a veterinary oncologist.
Yeah.
That team approach generally offers the best chance for effective management and really optimizing your pet's outcome and their quality of life.
So wrapping this all up then, what does this deep dive really mean for you, the listener, and your pet at home?
I think this really just underscores the incredible importance of making checking the mouth a regular part of your pet care routine and not just glancing at the teeth. Lift their lips, really look closely at the gums, check under the tongue if you can safely do so.
Yeah.
Knowing the potential signs of gingival SCC, even those subtle early ones we talked about, and just being aware of who might be more at risk. That's key. Because while this is definitely a challenging diagnosis, there's no doubt that early detection and pursuing aggressive treatment, especially in dogs, truly offer the best hope for a better outcome and more quality time with your companion.
Yeah, gingival SCC is definitely a tough one to face. But understanding its specific nature, that local aggression, the potential ways it can spread, and how treatments like that extensive surgery or radiation actually target it, hopefully. That understanding can make a significant difference in how you approach managing the disease and really focusing on your pet's quality of life, even knowing the outcomes can vary so much between dogs and cats.
It really does highlight those sort of hidden vulnerabilities our pets can have, doesn't it? Places we don't always think to look.
It does. And, when you think about how adaptable our pets often are to these really complex surgeries, like having part of their jaw removed, procedures that just seem so extreme from our human viewpoint.
Yeah.
It really makes you pause, doesn't it? It makes you consider how we define quality of life for them when they're facing something serious like cancer. It kind of raises that important question about trying to see it from their perspective, appreciating their remarkable resilience and, I guess, their capacity to adapt to challenges that we might find completely insurmountable ourselves. Makes you think.